Welcome to PHF webinar on day 1. We are going to see under the topic of exploring a clinical pharmacist's role. First we are going to see that role of clinical pharmacist in patient safety, or we can see in medication safety. Before going for the role of clinical pharmacist in the patient safety or medical safety, first we are going to see that what is our objective with this webinar. We are going to describe that how clinical pharmacists can influence the safe use of medication for the patients. We are going to describe how clinical pharmacists can influence the safe use of medication using automation and information technologies. And we are going to describe that how clinical pharmacists can influence the patient safety initiatives at hospital and organizational level. So before we start this topic, we will just go through the simple scenario that we have a competent clinicians, excellent communicators, knowledge managers, educators, leaders, problem solvers, and project managers, multitaskers, learners we have, innovators we have all these things in our health setup nowadays. But who is taking care of this medication safety? In the whole healthcare system where this word is, who is responsible for this word? Who is responsible for medication safety, or we can say the patient safety? The answer is direct, that we clinical pharmacists are responsible for this. And that is the main reason that in India it is not that much developed. That's why many problems are coming out regarding the treatments. So we are going to see that how a clinical pharmacist can be an important part in the field of in this area, that is medication. How a clinical pharmacist an important role in medication safety. We have about 7 statements, or we can say 7 goals through which, or 7 steps through which a clinical pharmacist can work nicely and effectively in the patient safety, or you can say medication safety. First is overarching. The overarching goal of clinical pharmacist is to optimize patients' outcomes, safe, efficacious, appropriate, and cost-effective use of medication. Judicious, safe, efficacious, appropriate medicines. Clinical pharmacists should serve as a resource regarding all aspects of medicines use and be accessible as a point of contact for healthcare providers. All prescriptions should be reviewed, interpreted, and validated by hospital pharmacist or clinical pharmacist prior to medicine being dispensed. Clinical pharmacists should monitor patients taking medicines daily or whenever medicine is changed to assure patient safety. It's the role of clinical pharmacists to ensure that patient is sticking to the medications or drug schedule. Because if they are not adhering to the medications, it may lead to the failure of the treatment, or it may lead to the diversion from the actual treatment, our actual results, what actually we want. When resource limitations do not permit the pharmacist monitoring of all the patients taking medicines, patient selection criteria should be stabilized to guide the pharmacist monitoring. What does this mean? For example, I am on the duty for about 2 hours or 3 hours. Now the problem is that I can't see all the patients within that 2 or 3 hours. So we have to develop a criteria. We have to develop a priority level by which we have to move. That I want to see this patient first, or like geriatric patients or pediatric patients we want to see first, or the patients with multiple drugs I want to see first, or the new patients who are in the hospital, we want to see those patients first. So we have to create a priority level. We have to stabilize the guideline for ourselves. How patients, so that we can go for the maximum patients and who all really need the help of clinical pharmacist or counselors. So our criteria should be, our guidelines should be for ourselves in such a way that it should provide us the optimum, we can provide the optimum service, or you can say maximum service to all the patients for the patient care. Clinical pharmacy should ensure that all patients are educated on the appropriate use of their medicine. Now, it is the huge duty of the clinical pharmacist to educate the patient regarding their problems, regarding their drugs, which drug is for what, why they should not skip their drugs, how they should take this drug, when all they should not take this drug, what all are the areas, common areas which they may observe, and they should inform the physicians. Regarding this, all they should tell to the clinical pharmacist should educate the patient. Clinical pharmacists should provide orientation and education to the nurses, physicians, and other hospital staffs regarding the best practices of medicine. This is clinical pharmacists to conduct a seminar or webinar and tell the nurses, physicians, other hospital staffs regarding that how they can use the medicines in a better way, how they can provide the better service to the patients. How they can go for individualized therapy for the patients, what all things should be taken care, and if there is any new guideline or new input in the treatment or patient care, clinical pharmacists should make the hospital staffs aware regarding that. Clinical pharmacists should actively engage in research into new methods and systems to improve the use of medication. Clinical pharmacists, actually, the life of clinical pharmacists is lifelong. They have to study, they have to update themselves regarding the new service, new guidelines or new resources or new articles which published regarding any treatments or any disease or any drug. They should be updated. Now, second point is influencing the prescriptions. How we can influence the prescription? Clinical pharmacists should involve in all patient care areas, prospectively influence the collaboratively therapeutic decision making. Clinical pharmacists can help the doctors in making decisions that which drug should be given. Clinical all patient rounds to assist with therapeutic decision making and advice on clinical pharmacy issues. Clinical pharmacist has an important role in guiding the healthcare professionals regarding the individualized therapy, how they can proceed for the individualized therapy, how they can go for evidence-based medicine. It's a role of clinical pharmacists to make the healthcare aware regarding the individualization of therapy, if needed for any patient. Clinical pharmacists should provide continuity of care by transferring patient medicine information so that the patient move between the sectors of the care. If in the hospital, if the patient is shifting from one sector to other sector, it's the duty of clinical pharmacist to provide the care that their service should be continuing. Continuity should be there in the service. It should not be like that patient left this ward or went to the other sector, then they are not able to contact the clinical pharmacist. Next is preparation and delivery of medicine. Clinical pharmacy should ensure that proper storage conditions are provided for all the medicine used in the hospital. Wherever the medicines are kept, either they are in proper condition, either they are in proper temperature, either they are in proper moisture, incompatibilities should not be there. The storage of drugs should not be in such a way that will deteriorate or disintegrate, or you can say that spoil the effectiveness or decrease the effectiveness of the drug. Then administration of medicine. Clinical pharmacy should ensure that the information resources needed for safe medicine preparation and administrations are accessible at a point of care. Even nurses should also know that should always know that how to administer drug, when the drug should be given, when drug should not be given, what are the major areas of the drug. So administration, the proper way of administration as well as the proper knowledge of the drug should be at the level of the care, means the person who is taking care of the patient, they should know about all these things. Clinical pharmacist should ensure that allergies are accurately recorded in the standard location the patient records and evaluated prior to the medicine administration. It's duty of clinical pharmacist to make sure that allergies has been recorded, and if the drugs are given, then those drugs are not in the allergic drug list. Storage of concentrated electrolyte products and other high-risk medicines on the patient ward should be eliminated by dispensing ready-to-administer dilution, or if necessary, storing such products distinctly labeled in separate and secure areas. Clinical pharmacist should be responsible for determining which medicines are included in the ward stock and for standardizing the storage and handling of ward medicine. So in a short way, we can say that clinical pharmacist has role from the entry of the patient till the discharge of patient. As soon patient enter into the hospital, the role of clinical pharmacist will start, and it will be till the patient is in the hospital and even after that. So we have seen till now that how a clinical pharmacist can manage the medication safety, how a clinical pharmacist can properly take care of the medication safety. A part of this things, small things like are also there, like ADR reporting, adverse reaction, drug interactions, which is within the we have within this prescription, influencing the prescription title, we can include these things. Like if an ADR is there, it's a duty of clinical pharmacist that if any severe ADR is reported, they have to inform the physician or the concerned doctors. If any drug interaction is there, then they should do the intervention and inform the concerned prescriber. If they find any incompatibility between any drugs, then also it's duty of clinical pharmacist to inform the concerned prescriber. It's duty of clinical pharmacist to make the proper way that how a ADR can be monitored, or how the severe ADRs can be reported, or drug interactions can be reported. So we can see that a clinical pharmacist has a major role while the patient treatment is going on. In a way, we can say that pharmacists are just a connecting link between the doctor and the patient, and the drug and the doctor. So I can say that if you see that where all pharmacists are from the manufacturing of the drug till the utilization of the drug. So we are a connecting link between the doctor and the medicine, patient and the medicine, patient and the doctor. Everywhere pharmacists act as a connecting link. We will see that how a pharmacist can play an important role in a healthcare system and in upcoming healthcare system in our next video. Thank you.